Hi, my name is Sergio Quintero, and today I'm going to inform you about MS. What is MS? It stands for multiple sclerosis, and it's a chronic autoimmune disease, which is the immune system is attacking the central nervous system, the brain and the spinal cord, damaging the nerves, which interrupts the information from the brain to any limbs, causing multiple symptoms. And as well, this disease is not noticeable. Now, to understand MS, we're going to go over the damaging nerves, the symptoms, the 4 types of MS, the treatments, and how it changes the lifestyle. What causes MS? As of right now, it's still unknown. We do believe that the stress on a person, it's the lead to make flare-ups of MS. And a flare-up is whenever the immune system starts attacking its host or the central nervous system. Now, the scientists believe that we are born with a genetic disorder that with the contact of an unknown agent, it activates the disorder of the immune system attacking the central nervous system. Now, lesions. Lesions are the damaged nerves. As you can see, this is a normal, healthy nerve right here. This is the myelin, which protects the nerves, where all the information goes through. Now, this is the immune system eating up the nerve. Now, this is what causes the nerve to inflammate and the information gets disrupted. Now, this does not heal. The treatment may help reduce the immune system attacking the nerves, and also any rehabilitation can help make up other nerves communication system so that you can continue functioning with your daily lifestyle. Now, the symptoms. There's 3 different types of symptoms. They're all different for everyone. We have the muscular, the sensory, and the mood. Now, when it comes to the muscles, we have stiffness muscles, involuntary movements, a lot of muscle spasms. When it comes to sensory, the feeling of pins and needles, where it's mostly affected. A lot of burning sensation. Most of the patients do lose some feeling on their hands, or where they're most affected by the MS. Now, when the mood happens, is that a lot of people get depressed because from one day to the next, they lose all independency. They become dependent from other people to be able to do things, to be able to try to be normal, because the normal for them is not normal anymore. It's very limited. So it's very hard on someone to try to continue being happy. Now, the different types of MS. So there's 4. The very first one is the clinically isolated syndrome. This is usually when the person has the first flare, gets symptoms, but doesn't have any more flare-ups. The second one is the relapsing remitting. This is usually someone that continues to have flare-ups. The symptom gets worse for a period of time, but then it becomes better. It doesn't become better 100% because the symptoms do stay there. However, it doesn't get any worse, only during the flare throughout the year or ever so often. Now, with the treatment, it does slow that process down. Then we have the primary progressive. Usually, this is when the person has flare-ups, gets worse, symptoms, and every time they have a flare-up, it keeps getting worse. There's no recovering after that. Now, the secondary progressive is when the person doesn't have flare-ups, but the symptoms continue to get worse, even with the treatments. Now, here are the treatments. First, we got the medications. There's 3 types. They got the pills, which usually are given twice a day. You take them twice a day. The injections, they're usually 3 times a week. Now, these 2 are given to the beginning phase of the MS patients. If that doesn't work or it doesn't slow it down enough and the person continues having a flare-up, they go into an infusion. Now, this infusion is the strongest medication there is right now, and it's every 6 months, and hopefully this can slow down or stop any flare-ups. And then after this, depending on how the person continues feeling, then there will be more medication that can help minimize those symptoms. All right. Now, the therapy, the physical therapy, it helps to recover the movements or the strength where it was most affected by MS, right? And then they recommend to go to the gym or do exercise to be able to get stronger of the muscles that actually do work, right? And also to continue that physical therapy and continue moving and enforcing the muscles that actually are working. Now, the lifestyle. The person's lifestyle changes overnight, all right? And when it comes to the normal of other people, like driving, it becomes very dangerous because now the reaction time is different. Maybe their affected leg is not fast enough, strong enough to be able to pick up from the gas pedal or to the brake. When starting to work, depending on what you're doing, you're standing up or you're sitting down, sooner or later, the muscle spasm starts affecting other symptoms, then the energy. That's the last one. Now we go into outside activities. We have to take care of ourselves due to the weather. If it's too hot, the nerve starts inflammation and the symptom starts flaring up. When it's too cold, then we feel other symptoms like the muscle spasm, the stiffness. It's very difficult to understand when will be the good time or a good weather to be able to be outside. So gotta take care of ourselves. Now, the energy consumption, there is a fatigue factor symptom. This is given to all the MS patients. There's fatigue when you wake up, there's fatigue before going to bed, and it's everything that we do is very difficult because it requires more energy than a normal person would use. So this is again why they recommend to keep going to the gym to build that stamina up to be able to continue doing what normal people do. Now, in conclusion, after learning all of this, please understand that March is the MS awareness. It's not only focused for MS, but it's focused mostly on any neurological disorders. So MS is one of them. There's a lot of organizations that they do for fundraising, such as Bike for MS and Walk for MS. And since MS is still a research, this is usually out there for people to help and, trying to find a solution for everything or to actually keep learning on what's going on out there. So I want to give this presentation so that everyone is aware that all diseases are not same like this. They're also as normal. So thank you very much for your time. And as you can see, I also have MS. So I want everyone to be aware of this. Thank you.